We know that Black women experience grave health disparities in comparison to our peers. And that's a pattern that I witnessed play out in my own personal life and community. I lost my mother at the age of 64 of congestive heart failure. And that pattern really repeated itself with countless women in my family and community. And as I shared my experience with other women, the story was the same. And so I recognized that this was not the exception, but the norm, and that we needed a vehicle to really advocate, highlight, and make a priority in our communities the topic and the subject of how we would collectively elevate Black women's health.
Right now, Black women have significantly higher rates of premature birth, adverse birth outcomes, and even higher rates of their babies dying before they reach their first birthday. Higher infant mortality rates compared to white women. Also, Black women have higher rates of heart disease, higher rates of cancer. There are many other things that we see as well, but Black women definitely are facing a lot, and it's due to a lot of things that we need to fix in our healthcare system, but also in society as well. There are a lot of things playing a role over the course of the entire lifetime, not just when they're adults, but starting even in infancy as well.
We know that Black people have a threefold higher risk of knowing somebody who has died from COVID relative to their white counterparts. I think that everybody is feeling the stress and the strain of being in an uncontrolled pandemic. And I think that Black people and Black women who are disproportionately likely to be essential workers, who are disproportionately like to have family that are essential workers, who are disproportionately likely to know people that have died from COVID. When I could talk about a lot of health challenges that Black women face, but I want to bring them back to the root cause, right? Healthcare can do but so much. We have to address the social conditions that provide environments where Black women are sicker.
We went public with what our statement about racism and a public health crisis. We did that in partnership with some of the other community organizations that are out there, public health being one. So we wanted to make sure that folks knew that we were really developing a strategy around DEI efforts to combat some of the racism that people of color was experiencing. We have a committee that's taking a look at some of our policies, and we'll be making recommendations about those policies moving forward. So we have partnered with Dane County Health Council, which is, I want to say this is very transformative that you don't see all the health systems coming together in this way. And so we come together to talk about one collaborative effort where we're all focusing not just our resources and our dollars, but we are really being strategic and intentional about how we do this work around saving our babies. And with that priority, it means that our goal is ultimately to decrease the disparities around birth outcomes for Black women, Black mothers, and their babies.
When we think about Black women's health, we've had to help our allies and partners and community understand that we can't look at individual health behaviors. It's often our assumption that if we just got Black women to eat better and to exercise more and to go to the doctor on time, that's wonderful, that's great, and we teach and we educate about that, and that's true, but it has its limitations. What we know from research and data is that there are structural barriers to Black women being healthy. And that's the bigger contributor to our outcomes, really systemic racism. And we know that social, economic, and environmental factors contribute more than half collectively to the outcomes that any person experiences, and particularly African-American women, as you layer on the impact of racial inequality and inequities and the basic things that you need to live a healthy life. Stable housing, stable income, living wage work, quality education, equal rights under the law, systems that work in your favor in the same way they work in the favor of others. When we begin to unpack those things, which we know from massive studies that there are racial inequalities that are stagnant and persistent, we then begin to better understand why Black women's health outcomes and of their entire family look very differently than the health outcomes of our peers because we're experiencing social and economic opportunity in a vastly different way. And that understanding has to drive our conversation about what is happening with Black women's health.